welcome from Jharkhand Ophthalmological Society. Research methodology is very important for not only ophthalmic residents but also for ophthalmologists who are presenting papers in the conferences, because it helps them understand how scientific studies are designed, conducted, and analyzed. It enables residents to critically appraise medical literature and practice evidence based ophthalmology. Knowledge of research methods is essential for planning and completing thesis work, writing scientific papers, and presenting research at conferences. It improves analytical diagnosis and clinical decision making. Research training also prepares residents for academic careers, subspecialty training, and participation in clinical trials, ultimately leading to better patient care and professional development. Now, over to Dr. Sunil Kumar, who is heading Jharkhand Ophthalmological Society's Academic Research Committee. He is the chairman of Academic Research Committee, Jharkhand Ophthalmological Society. Over to Dr. Sunil.
Thank you, ma'am. Good evening, everyone. So, on behalf of the JHOS AIOS, I welcome all of you in this very useful webinar on research methodology. And with us, we have Dr. S.V. Singh, who is the additional professor RIMS Ranchi in the PSM department and is the senior statistician at the RIMS and is very knowledgeable and qualified in this subject, research methodology. As we all know, the research is the backbone of the medical science. And the medicine is changing not daily, but every hour, every minute, every second, the medical science is changing. And this is all because of the research. So research is not only for the students or teaching institutions only, it is also for the every practitioner. Even the solo practitioner should do some kinds of the research. So with today's topics, we will discuss how to do the research. And with this, I welcome Dr. S.V. Singh for his presentation. So the floor is yours, Dr. S.V. Singh, sir.
Thank you very much, sir.
Welcome, sir.
Dr. S.V. Singh, sir, we are showing your introductory slide so that people have joined all across Jharkhand. The postgraduate students from Jamshedpur and other places also have joined, so they should know who is addressing them.
Yes, please.
It is none other than Dr. Shashi Bhushan Singh. Is it visible? Slide
yes, visible.
Shashi Bhushan Singh is the Assistant Professor Biostatistics, Department of Community Medicine, Rio RIMS Ranchi, and he has received 10 state oration awards. And now over to Dr. Shashi Bhushan, sir, and we are sharing his slides from our place. Please share the first slide.
To invite me to present this such a august gathering to discuss about the research methodology. Actually, every researcher needs to know what are the steps. So, what are the design? How to start your study? So, these are the very important points to discuss in terms of research methodology. So everybody knows what is research. Research is a scientific and systematic investigation to establish the new finding based on the evidence to find out to answer the question, research question. So it is all about the research definition. But firstly, you know how to start your research work. So if you feel how to conduct the research, so first what is the research question? So you first frame the research question. So overview of research outline of today's our presentation is covers way of doing scientific approach, what is research, research methods, research loop, goal of science, type of research, type of research design, and what are the types of variables, and how to test the hypothesis, and which design use in your research work, evaluating the research question. So these are the today's our discussion we cover. So firstly, you must know there are so many types of research, right? So in our setting, especially I am talking about the medical research. So medical research, uh, broadly, it is two types. One is experimental study, and other is observational study. So in that experimental study, you are conducting some randomized control trial. You can say it is crossover design. So these are the part of the you are providing the intervention to come out the solution, right? For the good method, RCT randomized control trial is a good method to establish the effectiveness of the intervention. So this is the way to establish. Suppose we are taking the medicine, so based on the research, there are so many phases of the trial: phase zero, phase one, phase two, phase three. Then after the phase three, it come in the market. Then you will use this drugs, any intervention, any therapy we can use after the phase three trial. So one component is we are covering says uh, experimental design, crossover designs. Next is crossover design. So it is very important. So we can also use this crossover design. Then next part is our observational study. Observational study covers cross-sectional study. You can say cohort study. You can say prospective study. We can say there are so many other type of study, not providing the intervention, not we are giving the intervention, that is called observational study. So broadly, they have two types: observational and experimental study. But all the study, we have some need to what are the steps. First, what are the steps to conduct the research work. So first is to define the research question. So, in your mind, if suppose you are a clinician having some doubts regarding some issues in your clinical work, then you can start some finding the literature, right? So, if you have any question in your mind, then you can review the literature. You can first do the review of literature. So through the review of literature, you can see there are so many things already have researched, right? So first you see what are the gaps where I am planning for the research. So first you find out the what are the gaps today's in terms of research or in terms of your knowledge. If knowledge is having gap, then you can come across to the literature review. If it is have some gap, then again definitely you do the literature review. After the literature review, you plan for the research work. So firstly, you define the what are the research questions of your research thesis work synopsis. So first you prepare the synopsis. So uh, just there are so many slides, but I am explaining all the things in a good way to listen, and definitely you follow this. My thoughts and my speech definitely will help you. So first step is to define the research question. So suppose, and again, how to define the research question, how to frame the objectives. So this is are very important. Simply, you can say, suppose I am planning to do some research work. Suppose yoga. Yoga can yoga reduce the blood sugar of the diabetic patient or not? Right. So this is our research question. But yoga can definitely help, not help. So uh, that will be evaluated by the research. So again, you refine the research question. So yoga, which type of yoga you have to plan? है ना? So is it 1 hour yoga? Is it only pranayam? You can also add the exercise. So all the things we have to define your research question. And what type of diabetes we have taken in your study, it will be also defined. So research subject and your intervention part both are very clear in your research question. Then how to frame the research objectives based on the research question. So there is one format. Have you everybody? I hope everybody knows about the PICO format. PICO. So PICO is P stand for the population, I stand for the intervention, and C stand for the comparator, and last word is O is outcome. Right. So these are the format to follow this naming that is objectives. Population means at which level of your population of the research we have to plan. So firstly, you need to define the suppose diabetes. Suppose you are planning for the effect of yoga on the diabetes patient. So diabetes type 2 diabetes, if we have planned for the type 2 diabetes, then we specify the type 2 diabetes population recently diagnosed in our clinical area. That will be again, it is well defined what population we have taken in your study. So this, firstly you define the population, then how to frame the research objectives. That will be very important because when you are preparing the synopsis, so first step is you frame the title. So title is what? Title is just reflection of the research question. So based on the research question, you are going to frame the research objectives. So first you do the title, first you frame the introduction part. So these are the format. Have you, everybody knows IMRAD, IMRAD. IMRAD is one of the format to follow the learners because learners have some problem to write the synopsis. That is called proposal also. This is called blueprint of the research also. So synopsis having uh, four component, especially introduction part. Last paragraph of introduction is the rationality of the study. You should define what is the rationality of the study. Then you frame the objective of the study. Objective of the study means you are framing the objective matlab means you use the active verb when you are writing the research question. Don't use the passive verb. So you listen very carefully. When you are writing the research question objectives, you must use the active verb, not a passive verb. So there is some difference between the active verb because action research needs some action, right? So use the active verb. And third one is based on the research objectives, then you plan for the design of the study. So what type of design we have to plan? This is very important. So there are so many design I have discussed, right? So we uh, definitely uh, ask to your PI or co-PI or guide what type of a study is better to answer the research question. Or you can ask the expert also, right? So in your field, there are so many clinical exposure. We have also, but definitely you take the help of the senior person. Okay, what are the design of the study is better to answer the research question. So design part is very important. Don't believe on only data collection. So design part, if your planning is very good, then definitely result will come in the right direction. So don't only prepare one CRF and collect the data. That is called research. No research. This is just you are bluffing the research. So research is a honestly we have to conduct the research work. So then design, after the design part, then again what are the sampling technique we have to use in your study. Then again it is come to the sample size. So these are the issues, these are the steps when we are writing the synopsis, especially. We all things have be explained in your study. So IMRAD stand for, I stand for introduction, M stand for methodology, right? So methodology is what? Introduction having objectives, methodology parts having population, what are the population we have taken, then second what are the sampling technique we have taken, then what are the what size we have taken in your study. So these all the parts of your, and then methods of data collection. So these are the various steps we have to follow during the study, when we are writing the synopsis. So synopsis writing is very important because synopsis is the blueprint of your study. If your synopsis is very clear, definitely your study will go in a good way. So this is very good method to write the synopsis. So there are so many workshop we have to follow. There are so many thoughts will help you to design the synopsis. So there, and then data collection, methods of data collection, then you write the results parts. After what do you plan after getting the data collection, after an analysis of the data, again it is better to make a dummy table of your, in during the you can say synopsis is the first invention of the research work. So during your preparation of the synopsis, you must know how to write the result, right? And there are so many things we have to discuss after the research. That is the part of discussion. So these are the format of IMRAD. IMRAD is a short name. It used by the learners, young researcher. Definitely follow this guideline. So first step of research is to find out the research question. Then again, you can say literature review. So second is the literature review. Third one is, you can say, again you frame a CRF based on the design of the study. You frame a CRF. Then after the CRF, again you collect the data. So collection of the data having some methods to a strategy to follow, definitely follow it. Don't hurry to collect the data. Don't take uh, you take the data in serious manner, because we are doing some research work, not doing just we take data. This data definitely reflects this your data will come with a new solution. So just just focus during the data collection, because there are so many errors, because life is full of errors, right? You can also day-to-day life you feel of the errors, because in data collection there are so many errors, measurement errors, sampling errors, the statistical error. So these are the errors to manage your data, because error management is also one issue of the any research work. So error, definitely error is happened, but definitely it will be managed. So we can manage your error, you minimize your error in your research. That is the motive of the research work, right? So, so these are the steps. First, you collect the data, collection of the data, then you then plan for that. Again, you plan for the data analysis. So data analysis, how to analyze your data. So this is very important. How to analyze your data? This is uh, there are so many things we have to read, or we can take the help of the seniors. How can analyze your data? Because analysis part is very important. So this is all about this actually, because if your analysis is going in a wrong direction, your result will definitely confuse, right? So result part, analysis part is very important. So there just we have conclude what are the steps. First is identify the research problem and questions. I have already told you. Second is develop hypothesis and research design. Second is how to develop the hypothesis. So what do you mean at first? What do you mean by hypothesis? Tell me any researcher, any our PG student or any uh, researcher, tell me what is hypothesis. Anybody can ask. Anybody can respond. Hello. Hello, my dear friend, my dear Dr. Isha, Dr.
Yes, sir. Yes, sir.
Anamika, Dr. Ashish. Can you explain what is hypothesis?
Sir,
First you introduce. First you introduce yourself.
sir, it is a
Dr.
type of
Isha,
guess
first
made
you
before doing a study.
okay. So hello,
Yes, sir.
Dr. Isha, first introduce yourself. First introduce yourself.
Sir, hypothesis is a type of it is a type of guess that is made before doing a study.
Okay, right. Next, anybody?
It's a
Yeah.
proposal
Okay.
that possibly explains some observation which you have. It's basically an educated guess which you have, which can be proved, which an idea basically. I'm Dr. Gulati, sir.
Mm-hmm.
Right.
Hi, sir.
Okay,
Hello. Good
Dr.
evening,
Gulat.
everyone. My name is Dr. Shreya.
Yeah.
I'm a first year resident. So, hypothesis will be basically something that it's a starting point, that something we are using as an assumption, as a starting point to go about something. So we can say that it could be a postulate. We are proposing, as Dr. Gulati also mentioned, we are proposing something as a beginning point to our study so that we can go about it and later on that basis, find a result to conclude in favor or against that. So that is what hypothesis is.
Okay. Next, next. Anybody? Can you explain through the example? Suppose we have any hypothesis, then how to frame the hypothesis?
So, for example, like we have been studying in our undergraduation, the very popular example of association of smoking with cancer. So, if we go about doing that study, for example, we'll put up a hypothesis, like we'll assume that our hypothesis is that smoking does lead to cancer. That is our hypothesis as a starting point. So, if we conduct a study in a particular group, in that group we shall be connecting these 2 points, and eventually at the end of our study will be proving the hypothesis either right or wrong if we go for a binary vision of study.
Okay, okay, good. Next, anybody? Very good answer, but I uh, brief you what is hypothesis. hypothesis, you can say it is a tentative assumptions of your study. What you have to assume before conducting the research work. They are like some doctor says smoking is a risk factor of the lung cancer, right? So definitely this is a research question. Is it definitely a smoke? A smoke will contributing for the developing the cancer. So this is our research question. So what is the hypothesis? Hypothesis: does smoking contribute for the lung cancer? Right. So again, what is the null hypothesis? How to frame the null hypothesis? Because finally you are testing the null hypothesis, not hypothesis. You are testing the null hypothesis. What is the null hypothesis?
Good evening, sir. My name is Dr. Vatsala Kumar. I am a third year resident at RIO RIMS. Null hypothesis in this case
All right.
would be that smoking does not lead to lung cancer.
Hello. Your
Hello, sir. Am I
sound is
audible?
breaking. Yeah, now adult. Yes, tell me.
So, as in this case, the null hypothesis would be that smoking does not cause lung cancer.
Okay, good. So which type of smoking? Smoking having some types, right? So first you fix the what type of smoking we have causing the lung cancer.
So, like
So
cigarette
definitely null
smoking.
hypothesis. Yeah, smokeless. We can say
Active,
smoking.
active
E-cigarette.
or
We
passive
can also
smoking, sir?
say e-cigarette. Huh?
Active or passive smoking? Passive smoking level secondary smoking.
Yeah. So null hypothesis, when you are framing the hypothesis, there again you frame the null hypothesis. And after writing and after framing the null hypothesis, then you again frame the alternative hypothesis. Because if you are rejecting the null hypothesis, it means you are not, whether you are rejecting the null hypothesis, you are accepting the alternative hypothesis. So again, you write the alternative hypothesis also. So every study, if you are planning for the research, every intervention first you frame the, after the objective, frame the hypothesis. So first is write the null hypothesis, and then again you write the alternative hypothesis. So it is very clear. So study, what are the outcomes of your study? You should must know, and what population you have taken in your study you must know, right? So these are the very important part. So hypothesis based on these things. So these are the hypothesis, and again this hypothesis will be tested by the statistical method. There are so many statistical tests is available to test this hypothesis. Is it significant or not? So after data collection, we plan for the analysis. Then second step is to first you frame the hypothesis and then go for the, then you plan again, develop the hypothesis, and I have already told about the research design. Then you start the conduct of the study. So starting of the conduct of a study means your data collection, you make a CRF, case record form. Based on the case record form, you start the data collection. So during the data collection, this is very important. I again repeat it because it is very important to method of data collection. So we are serious, right? We are very serious to when we are collecting the data. So based on your data, because everything will reveal from your data collection, right? So data collection is very important part of the research. Then method of data analysis. So plan for the data analysis. So data analysis have two parts. One is descriptive part and another part is testing part. So in a statistical point of view, you are estimating the parameter, and second part is you are going to test the hypothesis. So there are two components of analysis. One is what? You are going to test the hypothesis. And second part, you are estimating the parameter. Parameter means your population parameter, you are estimating the population parameter through the sample. So sample is again, it is very important. So sample, what do you mean by sample? Tell me, any our PG student, tell me. What do you mean by sample?
So basically, a sample is a subset of a population upon which our research are conducted and later can be extrapolated in consideration towards a larger population.
Yeah. Next.
So sample will be basically a representative of the kind of population that we are doing the study on. That the sample size that we select should represent the entire population that we are targeting.
Okay. Next. Anybody?
Sir, it could be a limited quantity of a population, which is intended to be similar.
Limited. Okay. Next. Next. You can speak, no issue, right? You can speak anything, right? Based on your day-to-day life, you are using the sampling. Everybody using this term, right? Sample. In medical era, we are using the sample, blood sample, right? So you are collecting the blood sample, and 5% ml, 5 ml blood will reveal all the biomarkers in your body, right? So sample, as you know, sample is what? Tell me. To the example, anybody can explain. Then I will explain everything. So sample is the representative of the population. So sample, you can say sample have a power to draw accurate picture of the population. Then it is sample. 5 ml blood, because 5 ml blood we are taken from the body, it means whole body blood characteristics are same. Then we can say 5 ml of blood will represent whole body blood, right? So this is all about that sample have a power to draw accurate picture of the population. So generally, we are collecting the data from the population. So it is not similar to same as the blood. So there are so many examples. Just see, in a twin child having no similar blood group, no blood hemoglobin level. So this means variation is there. So how to manage the variation in your data set? This is again very, very important. So sampling technique is very important. If you are planning for the research work, so sample definitely have a power to draw accurate picture. Then you can say it is sample. Not it is a you can don't say कि भैया it is just only part of this population. So that sample have a power to draw accurate picture of the population. If it is not, then it is not a sample. It is very clear. So sample is a we can say sample in day-to-day life. Every day we can use this sample in day-to-day life. Every during your marketing, we just check quality of the cloth also, right? So this is a way to check your cloth quality through the sampling. So this is the way to when hello, I am audible. Hello,
Yes, sir.
madam, I am audible.
Yes, sir, you are audible, sir.
Hello.
Yes, sir, you are audible, sir.
Okay. So there are so many sampling technique available with us right now. You can say simple random sampling, systematic random sampling, we can say cluster random sampling. So these sampling is under the parametric uh, uh, this sampling used for the parametric test also, right? And second part is non-parametric sampling, right? So this is all about snowballing sampling, judgmental sampling. These are the non parametric sampling. So there are two component sampling. One is parametric sampling, another is non-parametric sampling. So in our medical science, we have used all the sampling based on the research question. We can use quantitative study and qualitative study also. This is called mixed type of a study. So quantitative part is only for number. We are discussing about the number, frequency, percentage testing of the hypothesis. Qualitative part gives the depth of the cause of this any disease, right? So again, when you are planning for the research work, that is called mixed type. One is qualitative part, another is quantitative part. So again, comes to the only we are discussing right now in the quantity part. So in the quantity part, sampling technique is very important. One methods that is called PPS method, population uh, proportion to size, right? Population proportion to size. We have to calculate the sample size in different strata by the method of PPS method. So definitely, this method will help to uh, draw a sample to have a power to give a accurate picture of the population. So this technique is very important when you are planning for the study. Every time we ask to the seniors, ask to your experts to what type of sampling technique will be used, will be better in your study. Definitely, you ask the expert. Now, come to the research variables. What type of Hello.
Yes, sir. Now you're audible, sir.
हेलो
Are,
हाँ
hello.
हाँ आप ऑडिबल हैं और स्लाइड चेंज करने का कमांड दीजिए कमांड देने से आप लोग कर देंगे
Okay, okay, okay. Thank you, madam. Thank you. Actually, actually, slide. Okay, right. ठीक है. So next to the next slide. Go to the next slide.
यस सर
हाँ,
आ गया
Yes, sir.
हाँ. So ये just you see this slide. Through the slide, I will explain. No issue, right? So just see the limitation of intuition, right? In your mind, suppose you have to think about personal judgment, right? So definitely, this is these are the limitation of your study. Sorry, your institution involves the cognitive and motivational bias. Definitely, if institutional up, if you feel the uh, intuition regarding your opinion, then it involves the cognitive and motivational wise in a study. Encourage the conclusion about the cause and effect. है ना? The next slide. Then science, sta- science and empirical approach. So first is the empirical approach, then the false falsifiability, and then peer review. So these are the terms used. Then integrating in intuition, the skeptics, and the authority. Right. Next slide. So these are the observations accurately report to the other search for the discovery and verification the idea, main exchange of the competition among ideas, prior review of the research. So this is the theory of the science. Theory of the science, you accurately report to others search for discovery. Just see the words observation accurately reported to others search for the discovery and verification of the ideas. This definitely it will exchange and competition among ideas that will be based on the peer review of the research. Next. So characteristics of the pseudoscience. Pseudoscience means what? Hypotheses generated are not typically testable. Hypothesis, if you are framing the hypothesis, it is not testable. This is the characteristics of the pseudoscience. If scientific tests are reported, methodology is not
So you're not audible.
claim ignored conflicting evidence. Claim tend to vague and appeal to the preconceived ideas. Claim are never revised. Next, next slide. So systematic, what is the research? It is a systematic, I have already told you, it is a systematic process of asking and attempting to answer the question about the world. So this is, what is research? I have already told you, right? Next. So these are the 5 steps. Firstly, identify the research problems and questions. I have already explained all the things. Second is develop the hypothesis and research design. Then you start the study, that is called conduct of the study. And fourth one is testing of hypothesis. And then you elaborate the results, communicate to the result, communicating how to write your result part also. This is very important. So research finding often create new research question which result in the research loop. Next. So this is scientific step methods. Step one is first is developing the hypothesis. Therefore, after framing the research question, after again you can say we develop a research hypothesis. I have already explained. Second is then you do the experimental research. If you plan for the experimental research, then step 3 is the performing the experiment, and step 4 is interpreting the result. So these are the scientific steps, method steps you can say. This is the 4 major, we can say only major. There are so many sub steps behind this step, but it is the major 4 steps in your experimental process. Next. So scientific method description. What is the relationship found between the scientific methods? Ask the question, right?
So I'll move on to the next slide, sir.
Yes, we can move.
Right, sir.
So description, what is the relationship? Suppose you are only find out the relationship, then it is only describe the parts. So what are the relationship found between the consumption and aggression, right? Suppose between the alcohol consumption and aggression, this is only we have to define the relationship. But if you plan for the prediction, how many aggressive acts will person exhibit if he were to consume 3 beets, right? So this is the prediction part. Every research, definitely there's some regression model. We have to predict your finding, right? So this is a method of prediction. And causation and explanation, right? So does alcohol intoxication and or social expectation about drinking behavior increase the aggression? So this is the causation, because we just established the cause and effect. So first there are 3 we can say there are 3 signs we can also say. So first is describe your finding, that will give the relationship. Second one is the prediction based on your finding. Again, you make some regression model, and then you establish the conclusion and explanation. Next. Next. Determine the causality. Temporal precedence, cause must precede the effect. So cause and effect relationship, everybody knows cause and effect. Either you are starting from the cause and come to the effect. And there are so many retrospective study you can plan from retrospective, right? So first you see the disease cases, and then again go to the back direction. What are the cause? So this is temporal precedence, right? Then effect occurs when the cause is present, but does not occur when the cause is not present, right? Elimination of the alternative explanation, possible explanation for the causal relationship are ruled out. So this is determining the causality. Next. So type of the research approach, basic science and applied sciences. So there are 2 parts. One is I have already told, qualitative and quantitative approach, right? So type of the research approach is quantitative and qualitative approach. Next slide. So basic science, further understanding of the psychological functioning. This is covers in the basic science what is the nature of basis of the people's self-esteem. So this is covers in the basic science. Applied research provide the practical solution to optimize the psychological functioning. How do you increase the people self-esteem? So this is part of the applied research. So we people, medical, especially if you are doing the PG or MS course, it will comes under the applied research. Next. Next करिए. Hmm. Hmm. So type of the research design, actually a slide having some sharing due to this, there are so many 3-8, I hope it is wrongly written, but type of research design is non-experimental design. I have already told you archival, we just collecting the some narrative information regarding some thoughts, that is archival. Based on the available information, you just make some archival. Second is observational. This is non-experimental design, covers under the non-experimental design. And correlational study, right? Correlational study is also under the non-experimental design. And again, it is program evaluation. So this is archival, correlation, observational, program evaluation under the non-experimental. And true experimental design, that is randomization. That is called randomization. And another type of experimental design is also called quasi-experimental. Suppose you are planning for some research, intervention is definitely you will plan, but randomization is not possible. Then you can plan for the quasi-experimental design. Next slide. Next. So variables, definitely there are so many variables you are in research. So what do you mean by variables? Haji, variable का क्या मतलब है? Tell me. Hello. Hello.
Yes, sir.
Variables. What do you mean by variables? Variable का क्या meaning है? तो बताएंगे कोई? Anybody can respond.
Any parameter that will change with respect to other changes. So basically something that's written also that is not constant. So it will change on the basis of other changes.
The manipulable factor, sir. Any factor that can be manipulated or can be manipulated.
Okay. Okay. Next. Anybody? Hmm. Anybody can respond, right? No issue, we'll discuss. Everything should be discussed in this webinar, right? No issue. So variable is very important, right? Because we are conducting the study, every time you are talking about the variables. What are the variables of your research work? So firstly, I am asking what is the variable? Simple. It is variables means variables means
So
those.
something that is bound to change, expected to change.
Yeah, exactly. So subjected to bound to change in respect to time and in respect to man, right?
Yes, sir.
Suppose hemoglobin level is not same as other person also, right? So variable we
Yes.
can say it is a characteristics that is not constant. We can say also. टेल मी और कोई बोलना बोलिए कोई वेरिएबल के बारे में बताइए इट इज वेरी इंपॉर्टेंट outcome your study outcome is also a variable your dependent variables there are so many variables are independent of your study some variables are dependent on your study so variables are very important to explain during research work so variables broadly have two types, right? One is quantitative variables, other is qualitative variables. So quantitative variables means
Something
having
that can be
again two
measured, sir.
types. Qualitative variables, quantitative variables definitely you should measure, right? There are some have units. There are some units, right? So this is called quantitative variables. Hello. कैसे हो गए हेलो
Yes, sir.
आई एम ऑडिबल
You were not audible in between, sir. We lost the connection in between. Now you're audible, sir.
okay so variables I as I told you, variables having broadly two types. One is quantitative variables, other is qualitative variables. Quantitative variables means you are measuring something, right? Having some units. Suppose you have taken height, weight, age. These are the variables. This is called any biomarkers, hemoglobin level, creatinine level, blood pressure, pulse rate, heart rate. है that is called quantitative variable. Another part is qualitative variables. So qualitative variables having two types. One is nominal variables, and another is
Ordinal.
uh,
Hello, sir.
Hello.
Audible, sir.
I am audible.
Yes, sir, you're audible. Please continue, sir.
Okay, right. So first part is nominal variable in terms of qualitative variables. They have two types. One is nominal variable, another is ordinal variables. So what do you mean by ordinal and what do you mean by nominal variable? Anybody can respond. नॉमिनल वेरिएबल क्या है और ऑर्डिनल क्या है?
A nominal variable can simply be put as those variables in which there are no specific classification or ranking between the variables. But ordinal may there is a classification or orders in which the variables can be put or arranged.
So ordinal data will be basically a graded data. There will be a grading of the data. There will be a hierarchy in which the data will be present. It could be an increasing order, decreasing order. But on the other hand, nominal data is simply just a categorization of the data.
Mm-hmm. Hello.
Yes, sir. So, for example, sir, in nominal, we can say we are just simply saying this person is either male or female. We can say that way. But for ordinal data, we can, for example, we have to classify somebody into mild, moderate, or severe. That could be an example of ordinal data.
कोई और बताएं? So nominal data have no order, right? Order means you are just putting the order mild, moderate, severe. This is the order. So if your category having order, you can say it is ordinal data. Because when you are planning for data analysis, definitely you must know the nominal and what variables are in your study is ordinal. Hello? I am audible. Hello.
Yes, sir, you're audible. Yes, sir.
So it is very clear. So nominal data is having order, right? Ordinal data having order. So this is difference between the ordinal and nominal variable. So when you are entering the data, you are putting just one and two. Suppose one of the variable nominal like sex, male is one, female is two. So you can. Huh? So normally you are putting one for male and two for female. So it does not mean two is greater than one. When you are putting the order, suppose we have an ordinal variable, and then you put one for mild, two for moderate, and for severe. So this is 1, 2, 3 means they have some order. So there's some glitch, right? So must know what is the nominal and what is the ordinal. So variables definitely when you enter data, you must know variables how to enter your data as a nominal and next slide, please. Next slide. Hello, I am audible.
Yes, sir, you're audible. Is the slide not changed? I have changed the slide.
Yeah.
The visual and narrative
Next.
audible, sir. Next slide, sir.
Okay. Yeah. So Basic structure of the studies, study example for the of the relationship among variables. So this you see the on slide V. V means independent variables. And next is DV. DV stands for dependent variable. So IV is independent variable and DV is a dependent variable. So can give me some example. Can you uh, just you explore about the IV and DV? Anybody can respond, right? Through the example. Hello, 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 hello. I
Yes, sir.
am audible.
Yes, sir. You are audible, sir.
If our research can explain what the IV and to the example,
So the independent variable could be the duration of the diabetes mellitus, while the dependent of the same would be the grade of diabetic retinopathy, which can be present.
big retinopathy. This is your concern. Good example. So diabetic retinopathy, it is what you can say. It is, you can say IV or it is DV.
Sir, your voice is breaking up in between, sir.
Uh, I am asking retinopathy as told retinopathy is I or DV.
Yes, the diabetic retinopathy grade would be dependent variable, sir.
Okay, right, good. So it is independent variables. So what are independent variables in terms of in
Like
this study? Planning for to do. Uh,
like the duration of diabetes mellitus in itself is an independent variable, the duration itself.
duration, you can say it is also independent variable. Got the point? Age can also age. You can say also habit. So if these variables are very important when you are these are confounder. So there is one term is called confounder, right? So you have to manage the confounder you are studying. So when you are planning for any SC, you have to define what are the independent variables and what are the dependent variables. Next slide.
Yes, one second.
Next slide. So participants back. Participant study variable, right? Participant subject variables, situational variables, response variable. These are the types of the variable. Meditation variables. Meditation variables. There are so many variables are mediate in your study. So one is control variable, and last one is confounding variables. So these are the very important type of variables. When you are planning for the study, we all variables, if in your study, should be controlled. Otherwise, your finding having definitely gives results in a wrong direction. So every study, you fix the inclusion criteria, you fix the exclusion criteria. So based on the variables you plan for the, you just plan this type of a study subject will be selected in your study. So this is again, it is very important. Next slide. Next. So assessing variables, These are the self-reported. Can see. You just take the uh, there are so many studies. You just share the the respondent or subject. They will self-report, right? That is called part of any. There are so many type of study. You just share the questionnaire to the subject, right? Like opinion of any regarding the in terms of empathy of MBBS students. Suppose we are right. So again, this is a self-report. You just use suppose behavioral part of the any study. Again, it is use the assessing the variables. So these are the types of measures: self-reported behavior, behavioral, and psychological. Next, definitely you just see the relations between IV and DV. IV stand for the independent variable, DV stand for the dependent variable. One is exposure, exercise. Suppose you can take exercise and longevity. So limit of an exit when interpreting the relationship between the IV and V, particularly causal relationship, directionality problem, then you can say X, right? Suppose Y is suppose longevity, right? So longevity and Y is the variable of biodirectional, right? You can say exercise, third variable, that is Z. Z, IV and DV is the attributable to another variable, that is Z. So this is the directionality problem. So when we are planning for any study based on the uh, relationship independent and dependent variable, then you must think about the uh, this relation. Now come to the uh, systematic and random influences upon DV. So confounding variables, that are there are so many sources, we can say reason to exert meaningful influence on the IV and DV relationship is not measured because when you are conducting the study, you are not measuring the confounding variable, right? So is not measured because its value is unknown. We don't know what is the value of this confounding variable. So influence is also unknown. So definitely, if you are not measuring, definitely you don't know what this confounding variable will contribute and effect or produce the cause. Reflect the random error. है ना? This is the part of the random error, and it is uncontrolled. We can say uncontrolled influence, right? So we are planning for the study. Definitely, we are writing the inclusion focus on confounding variable. Next part is control value. Definitely, there are so many variables we have to reason to exert meaningful on the IV and DV. Next slide. Next slide. Hypothesis. As I told you, this is formally stated testable prediction about the pattern of relationship to be found among the variables. So this is, I have already told you, hypothesis is what is a tentative, that is called tentative prediction also, we say, about the pattern of relationship, right? We want among the variables, what are the relationship, what are the patterns of relationship, and how to testable prediction, right? So these are the hypothesis. And theory set of the interrelated statement proposed to explain phenomena. So this is the theory part. Theory is a set of interrelated statement proposed to explain. Next. So theory versus approach to research development, right? Top down versus bottom up approach. So there are two methods. Everybody knows top down versus bottom up approach. Hypothesis may be used to create the broader theories by inductive reasoning. This is called bottom up method. Theories may be used to test hypotheses by the deductive reason. That is called top-down method. So first you, through the theory, you can use the top-down method, and through the bottom-up approach by doing some testing the hypothesis. Next. So this is all about the bottom-up inductive reasoning. That is also it is called inductive reasoning. Reasoning that proceed from the specific cases to general conclusion or theories. Used in earlier stage to development of studies, phenomena, relies on the observation or data to help create or extend prior idea or theories about the relationship that exist in the world. So this is all about the bottom-up approach. Next, these are the theory part. Definitely must know, but uh, top-down methods is what? This is reasoning that proceed from general theories to a specific cause, used when there is a well-established theory that predicts certain observation outcomes. There are so many, definitely, there are so many well-established theory. So, this top-down method. Next. Uh, so next is design part, right? Which design to use. This is very important. I have already repeatedly told you about the design part. So we must focus on the design part. Every study should have a specific design. Don't say we collect the data, right? So method data collection before we are planning, you must frame the design of the study. Next. I've already explained all the things, right? So next, evaluation of research. A variety of standards exist for assessing the quality of theory and research finding. And one part is reliability and another part is validity. So reliability means what? Reliability means
Same observation in multiple measurements. A test is said to be reliable only if it is producing the same result on multiple measurements.
Hmm. Yes. कोई और बताओ? Hello.
Yes,
Hello.
yes, sir, you're audible, sir.
Reliability. Yes. So reliability. Anybody can also respond. Hello. So all about reliability, we can say it is measurement consistency. You can say if you are measuring blood pressure of the patient by this tool, and it is suppose it varies, it means it is not a reliable. So consistent measurement is very important of any intervention, you can say. And another part is validity. Validity reflects the accuracy of the construct of measurement. So there are two components. One is internal validity and other is the external validity. So these are very important. How to test your study is valid or not. Suppose you are developing some device, yeah, you can say some, you are developing some, suppose methods, therapies that will definitely it is valid or not, right? So definitely through the statistics you can check your finding is valid or not. So and you can also check the reliability of your study. You can say data of your reliability. You can check it, right? So there are some statistical concept like the how to check the reliability and validity. And third one is replication, right? Consistency in research finding when comparing the equivalent and similar conducted study. So replication is again it is very important. If you are something establishing this theory, this device, this intervention is definitely effective, and if in your study it is effective and another study is not effective, so it is definitely check your study is replicable or not. So replication again it is part two. Hello,
Yes, sir.
hello.
Yes, sir.
So reliability and validity and replication. These are the way to check your research. Hello,
Yes, sir. Hello.
I am audible.
Sir, the voice is breaking off in between.
Yeah, this is analysis, right?
Maybe a network issue, sir.
This is the very drawback of network.
Hello, sir. Hello. Hello, sir.
Uh,
Hello, sir. Hello. It seems that we are facing some technical issue with sir's computer.
Hello,
Yes, sir.
I am audible.
Yes, sir. You're audible now.
Yeah. Sorry यार ये just network issue. See the glitch of the network, right?
Right, sir.
So I am talking and validity. So this slide again explained about mandatory research. Uh, just is fast. This bull first is not, this is not valid. You can say also. Second, picture shows reliable but not valid because consistency is there, right? But validity is not there, right? But third, picture shows reliable and validity because all we can say it is come in the one whole say by your study. So this is what the validity this
So it's the end of the slide, sir.
so
Hello, sir. Hello. I think we are towards the end of the session, and because of some technical glitch, sir is not able to join. We would like to thank sir for such a tremendous opportunity for us to learn about the research methodology, the overview of research methodology, the formulation of the hypotheses, mainly about the variables, and we would like to continue tomorrow at 7 p.m. We would like to thank Bharti ma'am and Sunil sir for this platform. Thank you so much. I would like to end it now.